Hello. How are you today? Okay. Well, I'm JB, and I'm going to be your therapeutic touch technician today. It's my understanding that your primary care physician referred you to us for a basic checkup followed up by some therapeutic touch massage. Okay. So, like I said, we're going to be beginning with a really simple, basic physical exam. I'll be looking at your eyes, your ears. I'll be checking your temperature, your blood pressure, your eyes, a few things like that. Once you're all clear and looking healthy, what I'm going to do is I'm going to take a super comfy and cozy sleep mask. I'm going to place it over your eyes, and I'm going to give you your massage. We'll be focusing on the shoulders, the neck, the arms, and the scalp as well. The reason for the sleep mask is to put you in a sort of semi-sensory deprivation situation so that you can more fully enjoy the benefits of the massage. Also, we do book these rooms. I'm sure as you were coming down the hallway you noticed we have a lot of rooms, and that's because we book these rooms for a few hours at a time. So when you're done, once I've completed the massage, what you can do is you can take a nap, or you can go ahead and just get dressed again and leave at your leisure. It's totally up to you. If there is a specific time that you need to be out of here by, or that you need to be awake by, I believe you would have told our receptionist. Is that correct? Okay. Yeah, if someone needs to be out at a specific time, we always make sure that they're out at that time. So, let's see. Are you comfortable in the gown that you're wearing? Yeah, we invest a lot of extra money in these gowns to be really comfortable and soft and light on the skin. How's the temperature in the room? Would you like it to be a little cooler or a little warmer? Okay. Whatever you'd like is fine with us. So, if you just want to sit there and relax, I'll be doing the exam with you in your chair like that. After I put your sleep mask on, I'll be lowering your chair a little bit so I have better access to you. I'll be doing your massage, and like I said, after that, it's up to you whether you want to sleep for a while, take a little nap, or just get up and leave, okay? So, what I'm going to do is I'm going to begin by checking your temperature. Let's put this down. I have this ear thermometer here. And what I'm going to do is I'm going to check on each side. We're big on redundancy here. I'm going to be placing the tip into your ear canal. You'll hear a beep, and then I'll check your temperature, okay? And then I'll go around back and check the other side, okay? So let's go ahead and start on the left ear. All right. So you are going to feel the thermometer entering your ear. Looks good. All right, I'm going to move around back to the other side. Once again, you're going to feel the thermometer entering your ear canal. Good. All right, that looks great. Now, what I would like to do next is check your heart. Just going to take my stethoscope here and take a little listen. So I'm going to open up the front of your gown right here. Just expose your chest a little bit. Okay, so I'm going to warm this up for you real quick. Okay, shouldn't be too cold now. Okay, and I'm going to press this to your chest. You're going to feel me press. Okay. Take a deep breath in. Hold. And out. Good. Good. I'm going to try a couple other spots in the front. Gonna press. Breathe in. Hold. Breathe out. Good. Breathe in. Hold. Breathe out. Perfect. Okay, I'm going to check in the back. Alright, so I'm just going to undo the top tie in the back of your gown here. There we go. Alright. You are going to feel the stethoscope high up on your back here. Breathe in. Hold. And breathe out. Great. Okay. Gonna try a couple more spots. Breathe in. Hold. And breathe out. Good. Breathe in. Deep breath. Breathe out. Good. One more deep breath. And breathe out. Good. Alright, I'm going to tie up the back of your gown again. Great. Let's go ahead and check your blood pressure now. I have my trusty sphygmomanometer here and a blood pressure cuff. So what I'm going to do is I'm going to wrap it around your arm. I'm going to inflate the cuff. And once again, I'll be taking a listen with the stethoscope. I'm going to start on your left side, move around the back, and then I will check on the other side. Okay? Alright, I'm just going to tightly wrap the cuff around your arm. It should be on there firmly, but it shouldn't be uncomfortable. There we go. Okay, in just a moment, I'm going to inflate it. And then, using my stethoscope, I'm going to take a listen. Move around the back to the other side. Alright, and wrapping the cuff around your arm. There we go. Beautiful. Alright, perfect. Now, placing on some medical gloves for the rest of the examination. What I'm going to be doing next is checking your lymph nodes. And what I'm going to be doing is just gently but firmly pressing the area at the top of your throat, beneath your jawline. Just sort of gently palpating the area, checking for any swelling or bumps or lumps, anything that might indicate an infection going on. Just want to make sure you're in good health or reasonably good health before we proceed with the massage. If there is any illness, that can be perfectly fine. We just want to take that into account while we're giving the massage so we don't irritate anything. Okay? You ready? Okay. So you're going to feel my hands. Gently palpating the area. Okay. How's that amount of pressure? Good. Any discomfort there? Oh, right. So, let's see. Next, I'm going to be doing a quick eye exam. I'm going to take this pen light here, and I'm going to be shining it into your eyes as much as possible. Try not to blink, but if you absolutely have to, that's fine. I'll be shining it first in one eye and then the other. To begin with, I would like you to keep your eyes in a fixed position. So if you could please just stare straight ahead. Look directly at my nose. Just keep your eyes right here and try not to blink. Coming in on your left eye here, okay? So I'm going to bring that light in and out. Good. In and out. And I'm just watching the way that your pupil dilates and contracts. Okay. Blink if you need to. Looking at my nose, we're going to do the other eye now. Bring the light in and out. In and out. In and out. Good. Okay. Once again, with your eyes right here, I'm just going to shine the light a few times in this eye and then in this eye. So I'm just going to whoosh, whoosh, whoosh. Good. Whoosh, whoosh, whoosh. Just like that. Whoosh, whoosh, whoosh. Good. And whoosh, whoosh, whoosh. Perfect. All right. Now, I would like you to... What did I do with my pen? Here we go. So I have this pen here. And what I would like you to do is look at the pen. And I'm going to be moving it around. And as best you can, just follow the pen as it moves, okay? Good. Perfect. And now I'm going to be bringing my fingers in and out of your peripheral vision. So I'll be bringing my finger in. It's going to be wiggling a little bit. And just stare straight ahead at my nose. And let me know when you see my finger coming into your field of view, okay? Good. Good. Perfect. So, next I'm going to take this otoscope and I'm just going to be gently placing it in each of your ear canals, and it has a little light. See? Just a little light right here. And I'm going to be using that to take a quick look inside your ear, to look for any swelling. I'm going to be examining your eardrum in there, make sure there's no infection going on. Okay, so once again, I'll start on the left side, move around to the back, and check the other side. All right? Okay, you're going to feel the tip of the otoscope entering your ear canal now. And I'm just going to take a quick look around. Just looking for any redness, any signs of infection, anything like that. Okay. And taking a look at your tympanic membrane. Okay. Looking toward the back. Okay. Good. Now let's take a look at the other ear. Once again, you're going to feel the tip of the otoscope entering your ear. And this ear is looking pretty good too. Anterior, posterior. Look at that. Taking a look at the eardrum. And you're going to feel my fingers on the back of your ear right here. I'm just going to pull your ear up and back so I can get a better look. Perfect. Okay. Good. Perfect. So, next and finally for the exam, I'm going to be doing a basic dermatological exam on the areas that I'm going to be working on with the massage. So I'm going to be looking at your scalp, the back of your neck. I'm going to be looking at your shoulders, your arms, and your hands. And it's not going to be very invasive. I'm just going to be sort of gently probing and palpating, looking for any abrasions, any lumps, bumps, rashes, anything that I might want to work around or be gentle with. Okay? So I'm going to start in the front with your scalp. Let's see. Okay. Come up on my toes a little bit. Here we go. I'm going to come around the side here. Once again, just looking for any lumps, bumps, redness, abrasions, anything we might want to avoid during the massage. moving down back of your neck, right at the base of your skull here. And around the side. Working my way up. All right. Now I'd like to take a look at your shoulders. So I'm just going to be pulling your gown down gently, first on this side and then on the other side, okay? All right, so I'm just going to gently pull the gown down off your shoulder here. Examine the skin of your upper shoulder. Gonna pull it back up. There we go. Alright, I'm gonna push your sleeve up, and I'm gonna examine your upper arm all over. Working my way down to the elbow. You can just relax your arm into my hands. I got this. Okay. Checking your elbow. Inside of your elbow. Okay. Now, I'm going to start working my way down your forearm. Checking your wrist. Okay, I'm going to take your hand in my hand and just examine the skin on your palm. And back of your hand. And starting with your thumb, each of your fingers. 1, 2, 3, 4, and 5. Good. Okay, I'm going to move around to your back. I'm going to pull your gown down just a little bit at the neck so I can take a look at the back of your neck here. Just gently passing my fingers over the back of your neck. From your hairline down, the first few cervical vertebrae. Good. Okay. Let's go ahead and untie your gown so I can get a better look at your full back. So I'm going to undo the first tie. And the one at the middle of your back as well. Good. So starting at the upper part of your back here, I'm just going to start taking a close look at your upper back and your shoulder blades, and working my way down your spine to the middle of your back, gently running my fingers over your skin to feel for any lumps or bumps, anything my eye wouldn't catch. Good. Working my way down, from your middle back down, to your lower back. You should feel my fingers just lightly passing over the skin on your lower back. Looking good. All right. I'm going to tie up the middle of your gown again, on the back here. And the top one. Good, there you go. Let's move around to your right side here. And once again, I'm just going to gently pull the shoulder of your gown down here over your shoulder so I can take a look. Gently palpating the skin, taking a close look. Good. Okay, I'm going to pull the gown back up on your shoulder here. Good. Now I'm going to push the sleeve up so I can examine your upper arm. Working my way down your upper arm. Down, down to your elbow. Okay, and your inner elbow. Once again, just make sure that you're letting your arm relax into my hands. So I work my way down your forearm. Looking at the back of your wrist, palm of your hand. Okay, back of your hand. And starting with your thumb, each of your fingers. 1, 2, 3, 4, 5. Okay, you can just let both your arms relax at your side or in your lap, whichever you prefer. Great. So, I've gotten a really good look at everything I'm going to be working with. Your scalp, back of your neck, your shoulders, arms, your back, upper back. And what I'm going to do now is remove my gloves. And I'm going to place the sleep mask on now. And this is a it's a very simple but super comfortable sleep mask. I actually use the same brand at home when I'm sleeping. It has these really, I don't know if you can see them, but it has these really nice contours here. So it's contoured so that it doesn't press against your eyes. And it also has a nice little contour for your nose. So it just fits perfectly and softly, but without pressing against your face in any way that would be uncomfortable. It's very breathable. Okay, so if you don't mind, I'm just going to go ahead and place this on. Alright, let's go ahead and lower your chair so I can have better access here. Perfect. Okay, are you comfortable? Alright, well, if anytime you need to adjust your position slightly to make yourself more comfortable, just go ahead. Okay, so you're going to feel my hands touching your head right there. And I'm going to just start gently running my fingers across your scalp. And as I do so, I'm going to tell you a little bit about the therapeutic touch massage that we do here. So, our therapeutic touch massage focuses primarily on comfort and relaxation. It's not as intense as like a deep tissue massage or anything like that. It's just a lot of gentle touching and stroking your scalp, neck, arms, areas like that. And it's meant to simulate some of the physical benefits that come with comforting touch, like hugging or cuddling, or just being held by someone who cares about you, or having personal attention paid to you by someone who cares about you. Its therapeutic benefits include improved blood flow, relaxation, obviously, release of oxytocin, which is also known as the love hormone, or the cuddle hormone. One way that oxytocin is commonly produced in normal life situations is when a mother is bonding with a new baby by holding it and touching it and caring for it. It's a hormone that the body releases that improves bonding, feelings of safety and comfort, just an overall sense of well-being. And also, so many of us go through a lot of our lives without getting touched, maybe as often as we would like. So this kind of touch therapy can help us connect to another person and bring awareness to our bodies. It can give us a sense of groundedness. So many of us spend so much time in our heads. I know I do. So, sessions like this can help bring our awareness back down into our bodies, and that can help us function as more of a whole being. Now, as I get ready to move on to the rest of your upper body, we have a few different types of massage cream that we use. They're like a cream oil that we custom make here, so they feel very thick and rich going onto your skin, but they absorb very nicely, so you're going to leave with very soft skin. It's not going to feel greasy at all. We also have a few different options as far as scent goes. We have unscented, we have vanilla, rose, lavender, and sandalwood. Which would you like? Okay, you got it. And we also keep them warming in clay pots over here, so that when they go into your skin, they're nice and warm, and it feels like they're just melting into your muscles when they're applied. So I'm going to go ahead and grab the one that you chose here. Just making sure it's the scent that you chose. Alright. So, I'd like to begin with your left arm. I'm going to start up at the shoulder and work my way down, getting some of the cream onto my fingertips. And you're going to feel me placing my hand onto your shoulder. And working the cream into your skin. Using long, gentle strokes. How does the lotion feel? It should feel nice and warm. Good. I can already feel your muscles relaxing under my touch. That's great. Just relax. Feel the warmth of the massage cream radiating down into your muscles. Feel your muscles softening beneath my touch. Good. Now I'm gonna start working my way down your upper arm. Again, using long strokes with my whole hand, applying some firm pressure with my fingers. And it should feel like I'm squeezing the tension down your arm, like squeezing toothpaste out of a tube. Feel the tension in your arm melting down, down your elbow, down your forearm, down your hand, out your fingertips. There it goes. Good. Now you're going to feel my fingertips, the inside of your elbow, working in circles around the back here on your elbow. Now, working the massage cream down your forearm. Gonna get a little bit more here. Here we go. Okay. Down your arm. Gently squeezing the muscle as I move my hand down your arm. Good. Now I'm going to take your left hand in mine. Get a little extra massage cream here. Work it all into your hand. Your hands are going to feel so good when you leave. Nice and hydrated and relaxed. Keep massaging your hand Good. I can feel your hand relaxing beneath my fingertips. Hand massage is so underrated. We do so much with our hands. They really deserve more pampering than they get. The muscles in your hand are relaxing. Squeeze each of your fingers, starting with your thumb, pointer finger, middle finger, ring finger, and this cute little pinky. Doing some circles in your palm with my thumb. Alright. Gonna go back up to your left shoulder and work my way down one more time. Starting at the top of the shoulder. Working my way down your upper arm. Down the elbow. Down the forearm. Your hand. Your fingers. Beautiful. Okay. Now I'm going to move around the back here. So I'm going to scoop up a little more massage cream here. It's still nice and warm. Okay, you're going to feel my hand on your shoulder right here. Good. I can feel your shoulder relaxing pretty much right away under my touch. I like to see both your shoulders relax just a little bit more of them. So what I'm going to do real quick is I'm going to place one hand on each of your shoulders. And in a moment, I'm going to ask you to take a deep, slow breath. Hold it. And then when I tell you to let go of the breath, let it go nice and slowly. And I'm going to squeeze your shoulders firmly but gently. And in that moment, as I'm squeezing and you're exhaling, you should feel your shoulders melt down. And all the tension should just slip away, okay? So here's my left hand on your left shoulder, my right hand on your right shoulder. Take a nice deep breath, as deep as is comfortable for you. Good, now hold it. And on the count of 3, I want you to let go, and I'm going to squeeze, okay? 1, 2, 3, and squeeze. Beautiful. That feels a lot better. Your shoulders are a little lower now. Okay. So back to the right shoulder. Let's get a little bit more of that warm massage cream oil. Start at your shoulder again. Okay, yeah. That's much better. I'm going to start working my way down your upper arm. Up and down. With long, gentle strokes. Applying a little more pressure with my fingertips than with the rest of my hand. How does that feel? Okay. Here we go. Squeezing down. Placing my hand at the top of your shoulder again and squeezing down towards the elbow. Squeezing down and down. And one more time, squeezing down. All the tension squeezing out of your upper arm. Good. Now, working on the inner elbow with my fingertips. Working around back to the elbow. This cream is great on parts of the body where we tend to get dry skin, like on the elbows. Not that your skin is especially dry or anything, but definitely think you'll be able to notice the difference when you leave. Okay. And I'm going to scoop up a little more cream here. Oh, that's too much. Okay, here we go. And working my way down your upper arm. I mean your lower. You can probably tell where I'm touching you. Okay. Working my way down your forearm. From the elbow down, down, down to the wrist. Gentle strokes. Doing big circles with my palm. And then using just my fingertips for little circles. The fingertips should feel a little more targeted, a little bit more firm. When I use my palm to do big circles like this, it should feel a little bit more sort of relaxing. There we go. Your wrist, back of your hand. Using my thumb to massage your knuckles. Your palm. Good. Each of your fingers, I'm going to squeeze them from base to tip, starting with your thumb. Squeeze your pointer finger, your middle finger, ring finger, pinky finger. Good. Okay. Gonna move back up to your shoulder. You can probably tell that I used a little extra massage cream on this side, so I want to make sure I work that all in. Starting up back up the top here and working it in. Big circles with my hand. Good. Your biceps just melting beneath my touch. Down to the elbow. Inner elbow. And down your forearm. Beautiful. Alright, now I'm going to do a little focused work on just the back of your neck. I'm going to be using mostly my fingertips, moving in small circles. The circles should feel small and firm but gentle. It shouldn't be too intense, just very relaxing. So first I'm going to work the lotion into the back of your neck here. If you can just loosen up your neck a little bit, but sort of just kind of gently letting your head tilt to the side. And then let your head kind of float up and over to the other side and tilt a little in the opposite direction. Okay. And let your head float back up to the center. If you can kind of look down so that your chin falls towards your chest very gently. You shouldn't be pushing any of this. Okay. Alright. I'm going to take your head in my hands here. I'm just going to... I have lotion on my hands, sorry. I'm going to tilt your head back. And now just let your head rest and relax. Good. Alright. Your neck feels a little less tense now. I'm going to work a little more of the massage cream in. All over the back of your neck here. This is a really important spot. Especially for those of us who spend a lot of time using computers or looking at our cell phones. We can put a lot of stress on the back of our neck. So I want you to feel my fingertips working the back of your neck. Little circles on the left side. On the right side, good. Going down the back. Using my whole hand now. Feel the warmth of the heated massage cream radiating into your neck muscles, causing them to soften and relax. Good. Perfect. Perfect. Alright, so let's start working our way down your back now. I'm going to start up here at your shoulders and start working my way down. Once again, these are going to be firm but gentle strokes, nothing too intense. I'm going to start working it into your back. Working in big circles to start with. Working both hands down both sides of your back, down the middle. Good. The massage cream is still nice and warm, melting the muscles beneath them. Causing any tension in your back to melt, to soften and melt and drip away. Okay. Using both my hands, I'm going to pick up the speed a little bit to do these big circles. I'm going to wake the muscles up a little bit more before relaxing them and putting them to sleep. Alright. Now, starting with the left side of your back, I'm going to scoop up a little more cream here. Okay. I'm going to work my way down the left side. Using my fingertips in small circles, working all the way down the left side, from your upper back, down over your shoulder blade, down your mid-back, down to your lower back, giving a little attention to your very lower back here, just above the glutes. Same thing on the other side. Starting with your upper back, going down over your shoulder blade, down your mid-back, using my fingertips in little circles. Down to your lower back, and using my thumbs to really work that last bit of tension out of those lower back muscles just above your glutes. Good. And just a few more long strokes. And just a few more long strokes covering your whole back, starting with the shoulders, going all the way down to the bottom of your back. Deep breath in. Hold. And breathe out. Good. Perfect. Alright. Moving my hands in slow, gentle circles. Just to kind of signal your muscles that we're finishing up. So they can truly relax. I call this putting your muscles down for a nap. Beautiful. All right. I'm going to go ahead and leave the room now. You may rest or nap, and then go ahead and take the mask off and get dressed at your leisure. Thank you so much for visiting us today. You've been a wonderful patient, and we hope you'll come and see us again soon.